Good afternoon, everyone, and welcome to our first broker and employer town hall for Geisinger Health Plan clients and brokers. My name is Don Stanziano. I'm the Chief Marketing and Communications Officer at Geisinger, and I'll be moderating the session today. First, I'd like to give you a few housekeeping items to make sure that you can hear us and participate in this two-way conversation. There is no dial-in number for this meeting, but there is closed captioning available. If you want to turn that on, there is a button in the lower right-hand corner of your screen to do that. The presenters will not be able to hear you. You can hear us, but we cannot hear you. So in order to share your questions, please submit them in either the lower area of your screen below the slides or to the right of your slides, depending on how your setup is on your computer. There will be a recording of this presentation available after the event. And with that, let's get started. Our speakers today are Dr. Jaewon Ryu, President and CEO of Geisinger, Kurt Roble, our Chief Financial Officer and Interim Leader at Geisinger Health Plan, and Allison Hess, Vice President of Health Innovations at Geisinger. We're going to kick it off with Dr. Ryu.
Thank you, Don. And thank you to everybody for joining us today. We've been trying to do these town halls virtually, obviously, over the last several weeks with different segments of audience. We started with doing them with our internal audience, with our employees, and that's been pretty well received. It's allowed us to work some of the kinks out of the technology, so hopefully it'll be a little smoother today. But we've been doing that on a weekly basis, and now starting to incorporate folks from outside the organization who are important to what we do day in and day out, and certainly you all represent exactly that. So we're thrilled to have you join us, and maybe I'll just go ahead and kick it off as we always do with this, which is the national outlook, and you'll kind of see how we track the numbers and start zooming in to more local dynamics, because I think the story is more local, and what we've learned about COVID is that the impact is also very local. But I think it is important to just keep in context what's going on the national framework. And you all have seen different versions of a slide that look essentially like this, I'm sure. You all keep track and hear from the media, as do all of us. But on the national stage, I'd say the numbers on the left really illustrate what a difference a month makes. And so you could see the considerable increase in number of cases and number of deaths over the last month nationwide. At the same time, nationwide, we're seeing the beginnings of a flattening of these numbers. And so that's a good thing. I think a lot of good efforts around the distancing, the precautions, and so forth are starting to bear fruit. But at the same time, we also want to make sure we stay cautious, because we know that a lot of the national numbers are driven off of the New York numbers, because it's such a big part of what's driving the national numbers. And the New York numbers have flattened. And so as a result of that, I think the national numbers are also somewhat flattening. But we also see that there are emerging hotspots where they're still on the upswing of this journey, whether it's Chicago or even as recently as last week, Philadelphia was included in that mix. So we know that there's still some markets that have yet to pick up steam or yet to be on the other side of the peak. So I think there's a tale of many stories underneath this one national picture. Next slide, Keith. And then we start zooming into Pennsylvania, and this should look pretty familiar to you as far as the map. There's both county and zip code represented here, and it's a heat map, so the darker the color, the more density of cases, or the more positive cases there have been. And you could see that the area surrounding Philadelphia is one of the hotspots. And then all along the New Jersey border, I think, is another hotspot. And for the areas that Geisinger serves, what we call our Northeast, or Luzerne and Lackawanna counties, has been a hotspot. And that's certainly reflected in what we've seen as far as patients inside our hospitals, Luzerne and Lackawanna has seen the earlier spikes, albeit more recently seems to be flattening, but those are the areas where we've seen a bigger part of the volume. And then beyond that, as you get into the different areas, there are pockets, but not quite as significant, and that also reflects our experience inside our hospitals, where we see some volume of positive cases, but not the kind of spikes that we've seen up at GCMC in Scranton or GWV in Wilkes-Barre. Next slide, Keith. Here are some of our numbers. At this point, we've tested just about 14,000 people, and we've had about 15% of them test positive. And that's roughly held steady, believe it or not, since we first started doing testing, gosh, I guess it was 6 weeks or so ago. I think we're also very lucky, and we've been very fortunate because our preparation efforts date back to January with our emergency response and preparedness team kind of quietly plotting our steps around equipment, staffing, and also data and tracking, but most importantly around testing and availability. And so we were one of the first 2 or 3 sites in the entire state of Pennsylvania that had the ability to do our tests on site, as opposed to having to send the tests to a commercial lab. And that ends up being a big difference because even the state-run testing sites, they do the tests, they do the swabbing, but then send the test out to a commercial lab. And sometimes those results are frequently days, and at one point it was as long as a week. And when we run those tests in our own laboratory, the result comes back in hours. And so that's been a critical piece of how we've gone about this. And of course, that allows us to conserve on our use of personal protective equipment as well, because we know when someone is negative, we know that faster, and we don't have to use as much personal protective equipment. But as far as the testing itself, 15% or so have been positive. And of those that have been positive, about 15% of those end up requiring hospitalization. At this point, we have a little over 100 patients hospitalized in our various campuses across our system. And that number has been trending a little bit lower over the last several days. And so we think we're seeing the earlier parts of not just a flattening, but maybe even a slight decrease. And that's a good thing. At the same time, we've had 57 or so deaths. At the same time, though, it's also important to remember that every day people are getting discharged from the ICU and well enough to go on the general floors. Every day we're seeing patients get discharged from the hospital altogether and make a full recovery from the disease. And of course, every day, 85% of the folks test negative. And even of those who test positive, another 85% we see never requiring hospitalization. So as serious as the virus is, and it is serious, it can be very serious and devastating, I think it's sometimes worth the reminder that there are a lot of folks dealing with the virus and making great recoveries as well. We see both. Next slide. What we've been hard at work, and this involves a lot of coordinated effort, but we've been hard at work around planning for potential surges, because if there's one thing we've learned, this whole chessboard changes very quickly, and all it takes is for there to be one hotspot in the community, whether it's a nursing home or a place of work or a place of worship or any place where there's a concentration of cases. That's all it takes for there to be a blossoming of cases throughout the community. And so we know that at any moment there could be the surge. And at the same time, we also know from our data projection models that every area that we serve will have some component of a surge. It's just at this point, our projections suggest that that surge and the peak is flatter than what we had projected in the weeks prior, and it's pushed further out in time versus what we had planned for originally. Those are both good things. It means that we as a society are doing a good job with the precautionary measures, but we keep our eye on that and run our prediction models at least once a week and sometimes twice a week, but that's what it's showing. And as I referenced earlier, the biggest spikes are seen in the Northeast with Luzerne and Lackawanna County. But again, even there, it feels like we're on the other side of the flattening, which is a good thing. Next slide. This kind of gets to what I was talking about earlier. This is a picture of 3 of our ICU nurses from GCMC up in Scranton. And you can see one's holding up one finger, another has 2 fingers, another has 3. And they're counting the patients that day who were able to be discharged and weaned off of a vent in the ICU. And so typically if you're in the ICU, you're there because you need ventilation. And that day they were able to get 3 patients off the ventilator, which means those 3 patients very quickly after that were probably able to leave the ICU and go to a regular hospital bed. But a good illustration of the kinds of things that we're seeing with recovery of patients. And on the left-hand side, you could see we have these whiteboards up in our care delivery areas because sometimes I think folks are so focused on the number of positive cases, number of admissions, number of people on ventilators, number of deaths, that sometimes we lose sight of all the good things that are going on as well as far as people recovering and getting off ventilators and so forth. So this is a good illustration of how we're trying to keep people focused on the balanced full picture that while there are devastating impacts, we're actually making quite an impact as well on helping people to recover. Next slide. This has been one of the big themes of how we've been able to still deliver care, because while everybody is laser focused on COVID, we of course know that the folks with diabetes, their diabetes does not go away. The folks with congestive heart failure, their congestive heart failure does not go away. The folks with blood pressure issues, those things don't go away. And so there's still going to be care needs that we need to be able to address and meet the needs of those in our communities. And we're already seeing that things that might have been able to go 4 weeks without care, gosh, when you start getting out into 6 or 8 weeks or longer, it's tough for those patients who may be having pain from different conditions. They may be having some bleeding from different conditions. They may be having damage to their heart or lungs from different conditions. And so telemedicine has been a big way that we have met those demands. And we continue to see this program grow. We've always had some telemedicine activities going on throughout our system. I think some of you are aware of our EICU capabilities, our telestroke program, our teledermatology program. We even had some semblance of a telepsychiatry program. This is all prior to COVID. But after COVID, we're now seeing it across all of our specialties and have seen activity levels go up from a typical day at Geisinger throughout our system before COVID. We had maybe 50 or 100 telemedicine visits. Now on a typical day in the Geisinger system, we have 4,000 or 5,000 telemedicine visits happening on a daily basis. And so I think this has been a resounding success, both with the providers, but also with the patients out there. We get a lot of good feedback about how they're surprised that so much can be addressed through virtual means and how they're really happy with the interaction and so forth. It takes a little bit of learning. You know, it's much like all of us doing something like what we're doing right now with the virtual town hall. But as people have gotten accustomed to it, this program has really taken off, and each week we've seen the volumes go up. Next slide. And so here's a good illustration. So we went from, and it doesn't even show you the true before, which goes back to early March, and you'll see that our number of visits is in the 100 or less range. And now on a typical day, you got 4,400, 4,200. And I think more recently, we may have even tickled 5,000. And so this program is something that if there is a silver lining from all the COVID things, I think this will become part of the new normal of how we deliver a lot of our services. Next slide. At the same time, I think some of you are aware, many of you are aware that we have our own mail order pharmacy program here, which is pretty much a differentiator, I would say, because a lot of health plans typically have mail order pharmacy, but it's very rarely integrated with the same electronic medical record that the patient gets their care on. I think we're one of the few across the country where that happens to be true. And so the importance of that is if you have hypertension or diabetes, and let's say your physician changes the dose on your medication, that dose change doesn't get alerted to your pharmacy right away in a normal circumstance. And so it may be tough, and you know, as an ER doc, I could tell you so many times patients come in confused about the dose change because it didn't translate over into their pharmacy. What's different about our mail order pharmacy is it all sits on the same electronic medical record. So when those dose changes happen, when the medication changes happen, our clinical pharmacist team immediately is notified, and they're able to do the outreach, the medication reconciliation, and provide that coordination of care for the patient. At the same time, for many of our GHP products, it's a lower cost out of pocket for the member. And what we've also seen clinically is that it's linked to a 37% higher rate of patients staying compliant on their medications, which, as you can expect, if you're talking about things like diabetes and high blood pressure, congestive heart failure, if folks are taking their medications 37% more of the time, their outcomes are clearly better as well. So you can see year over year, our mail order pharmacy program continues to grow. And this has been an absolute godsend during COVID, where instead of having to come into the pharmacies, our members who are on this program are able to just get their medication sent to them over the mail. It lands on their doorstep. It's about as convenient as you can get. And our year-over-year increases, we were already making good progress, but the COVID has accelerated that as well. And another program that we're pretty sure is going to be featured prominently in our new normal. Next slide. As we look out into the future, and even some of the things that we're working on right now, these are some of the questions we get asked quite a bit is around treatment. And do we use this drug? Do we use that drug? The answer is yes. We have a team of experts here between our critical care team, our infectious disease team, our epidemiologic team, and our nursing team, and our research team, who have come up with our care protocols and algorithms. And we try to adhere to certain types of patients, depending on what their constellation of illness is and where they are in the disease course. We have different medications that we feel are appropriate at each of those times. The other thing to note for Geisinger is we also participate in some of the clinical trials that are happening nationally to evaluate some of these medications in a more scientific way so that we can tell the difference between when a drug happens to be lucky versus when it's actually good. And so we've listed some of those, and some you've heard in the news, whether it's hydroxychloroquine combined with azithromycin, or it's the use of convalescent plasma, which is the plasma from folks who have already recovered from COVID on the belief that their antibodies may confer some sort of therapeutic benefit to those who currently have it, or antiviral treatments like remdesivir, which has been in the news from yesterday because of some of the early findings, or sarilumab, which is part of an anti-inflammatory set of medications, which is a clinical trial that we are involved in, and in fact, one of the only sites in the entire state that's involved in that program. These are the things that our research oversight team is keeping close tabs on and making sure we're up to date on the latest and greatest treatment algorithms. I think there's still a lot more learning that us as a society, us as a country, are still going to have to go through in terms of which drug for which patient at which point in their disease course. And those are key questions that still remain to be seen. But we've seen some good promise with some of these interventions, and it has allowed us to make the impact that I referenced earlier around people making recoveries and improving in their clinical condition. The other question we get asked quite a bit about is antibody testing. Little different than the diagnostic testing to figure out do you have the infection or not. The antibody testing has to do with do you have antibodies in your system that may be helping you have immunity to the virus, and this typically comes as a result of having already been infected. The testing on this, though, is still a little bit not quite ripe for prime time, is what I would say. And there are 3 or 4 tests that are commercially available. Our lab team and our lab microbiology experts are studying those and evaluating those. I think the question is, exactly what do we plan to use it for? Are they accurate enough, and how would we roll them out? And those are all things that are being evaluated as we speak. Next slide, Keith. This is another one that's just really encouraging and uplifting, is all of the surrounding support that we've been getting from our communities. And it's been just a groundswell of support, people raising their hands, wanting to know how they could be helpful, what they can do to support us. And this is beyond just the signs of support or the honking of the horns or the things written by children on the sidewalks to encourage our staff. This is also monetary donations, which is what you see here. And we've gotten them from local folks and local organizations, both big and small. And that's helped us purchase a lot of the equipment that we have. And I want to thank really the business community in particular that's really stepped up and risen to this occasion, because you see some of the logos there at the bottom, but there are many others, and it's been a good show of support for all of us as a community. Next slide will show you a lot more local businesses that have stepped up with in-kind donations of different equipment. And as you can imagine, some of these are construction companies, some of these are local universities that have been able to either make or donate things like gloves, masks, other PPE, monitors, radios. There's a whole host of things that we are super appreciative and lucky, frankly, to have the support of our communities. Some of these are local. Some, like Rite Aid, Walmart, or Lowe's, are national. But believe it or not, even the national support, each has a local flavor of a story behind how they came to give back to the Geisinger organization. And so wanted to give a shout out because this has been a big part of the effort. Next slide, Keith. And I'm going to turn it over to Kurt Roble, who's our interim CEO of our health plan. Kurt?
Yeah, thank you, Jaywan. I also want to personally thank the business and broker community, not only for participating in this call, but also supporting Geisinger in a number of ways. And I think Jaywan highlighted some of those things where they supported our clinical delivery system. One thing that we pride ourselves at GHP, but I'd say Geisinger as well, is being closely connected to the communities in central Pennsylvania. And this call is just one example of us connecting with the broader community. As we go to the next slide, Keith, one of the things that we've been working closely with both brokers and employers is trying to react to all of the uncertainty associated with COVID, particularly the financial challenges. And we have worked hard to proactively reach out to the employer and broker community to help ensure that they have knowledge of the CARES Act and also ensure that they have all the necessary documentation to apply for loans. And that's something that our account executives have worked hard with employers to make sure that we're doing all we can on our side to react to this COVID situation. We understand that this is a difficult time and want to make sure that we're doing all we can to help. One thing I would say is if you have any questions or concerns about the CARES Act and need documentation or any help in any way, we hope that you reach out to our account executive team to make sure that you receive everything that you need from us. One of the things that we've done in addition to that is we've also started accepting credit cards for premium payments just to offer an additional channel to facilitate payment for your premiums. So just another example of us reaching out to employers and brokers. One of the things that we've done as part of our effort to keep the people of our community covered, we're also working diligently with employer groups to help them meet their premium commitments. We're working employer group by employer group to make sure that they can meet their premium commitments. Beyond premium payments, we've also extended coverage of dependents who turned 26 in April and May to June 30th, 2020. In addition, through June 30th, we are also relaxing our activity, our requirement around working at an employer to allow them to have coverage for people who have been laid off. So again, another example of us working closely with employers to ensure that people have coverage. Go to the next slide, please, Keith. Another thing that I talked about earlier is connecting with brokers and employers. And one thing that we've been doing is we've been sending out weekly bulletins to the employer and broker community, highlighting our work from both a health plan and also a health system perspective. We hope this added resource is providing you with important information about our insurance coverage as well as important clinical information. Again, another example of us reaching out to the broader community. You go to the next slide, Keith. We take real pride in helping our members, both as members and as patients. And one of the things that we've been saying quite a bit is we're all in this together. One thing that Jawan likes to say, and we understand this, and we're doing all we can to improve the health of the people in central Pennsylvania. In a time of a pandemic, we take this even more personally because precautions that limit the spread of the virus help ensure the safety of our coworkers, the nurses and doctors providing treatment to COVID patients. So this is extremely important to us. To this end, we're doing our part of the health plan to ensure that there are no financial barriers to receiving care as it relates to COVID treatment. We've eliminated cost sharing for COVID-19 testing. We believe this ultimately is the right thing to do to encourage testing and help limit the spread of the virus. Consistent with this type of thinking, we also have no cost sharing for COVID-19 for in-network inpatient treatment. For telehealth services, we also understand and have seen in our own clinical practices, as Jaywan's highlighted, the desire for patients to see physicians by both video and telephonically. We have responded by allowing telehealth services with no cost sharing through the middle of June. And by virtue of doing this, we've seen an enormous spike in the use of these services. To date, just through our Geisinger system, we've seen over 15,000 telehealth visits with our physicians. In addition to that, recognizing the unique environment created by COVID, we've also lifted prior auth requirements for a number of services, including COVID-19 testing or treatment for both in and out of network, durable medical equipment, and post-acute services. We're doing all we can to react, I think, in the right way to this COVID pandemic. We're also trying to facilitate care in the home through personal care and home health visits. From a prescription perspective, we're also allowing early refills for 30 or 90-day prescriptions at retail pharmacies and allowing early refills on 90-day prescriptions from our mail order pharmacy. So that's what we're doing. I think one thing to personalize this, and this is, I think, an important point, is for the over 1,400 members in our health plan who have tested positive, we're doing all we can to ensure that the high-risk patients among them are receiving the best access to care, including offering individual case managers for those that are the most risky. We're also providing special COVID kits that include Tylenol, a thermometer, and a device to measure oxygen levels. We're also providing special accommodations for members who cannot leave their home, including personal items, food, and even formula for women with children. In addition, as we always have done for Geisinger at home patients, we're providing treatment to COVID positive patients in the home. So again, we're doing all we can to connect with individuals that have been impacted by COVID. The next page, please. Continuity and planning, I think it's one of those things where you always talk about what will happen if a disaster occurs, and we had a plan in place and we were able to execute on it. Like most of you, we had to go from normal operations to managing our business remotely all within a few days. I think few of us will forget the day when the governor ordered the closure of businesses on March 18th. It was an amazing time, and we were able to react within a few days to almost send our entire health plan home, to work at home, and we've been able to do that effectively. So other than a handful of people, for the most part, we're operating virtually. We're also staffed and prepared for the expected surge in services once the COVID pandemic ends. We have redeployed certain people in the health plan to other parts of the broader integrated system, but once the surge occurs, and we do intend to move people back to the call center and other parts of our health plan operations to ensure that we have the capabilities to react to that upcoming surge of activity. Next page. One thing that we've recognized with COVID, and I think there's a real opportunity for us to take a fresh look at everything that we do as an organization, whether it's the Geisinger Health Plan or the broader Geisinger organization. While the pandemic has certainly been challenging, we want to find a silver lining, and we're looking at every opportunity to find areas where we can change what we do on a day-to-day basis. You go to the next slide, please. This slide gives some things that we've been thinking about from a recovery perspective. As we both return to work after COVID, we're looking to reimagine and then reform what we do on a day-to-day basis. This slide highlights some of those different stages. In terms of reopening as we return to work, thinking about a new normal as we go into a post-COVID period, and thinking about different rounds as we make changes. And this slide just highlights the different stages of that. One thing I would say from a specific perspective, we have found, and this is one particular case of it, virtual events to be particularly well received in our community. And we think these educational events like what we're doing today will become an important part of how we interact with the community. I think we also view these events as important educational sessions that are important to fulfill one of our most important goals, which is become a trusted advisor to health in our community. As Jaywan alluded to, site of care will also likely shift with telehealth becoming increasingly more important. Mail order pharmacy will also become more important as members access drugs more conveniently. One thing that we found through the pandemic is that it's becoming increasingly important to connect with all communities in our region. In keeping with this, we are looking to continue to expand our multicultural language, communications, and marketing efforts with the Spanish-speaking community.
Just on that point, Kurt, I think what's been kind of interesting about what we've learned and what's come to light as a result of this is the value of having both the health plan and the clinical enterprise integrated as part of the same organization really illustrates that some of those neat program things that we mentioned, whether it's Geisinger at home, actually taking physicians and moving them into the home to deliver care, or telemedicine, or our mail order pharmacy. These are all examples of things that are better care models, but more importantly, they're able to be pulled off because of the integration with the health plan, because oftentimes those programs in a non-COVID environment, you can't pull it off with other health plans because you're not reimbursed for them. And so it kind of stops a lot of those kinds of programs in their tracks. But the value of having GHP and the clinical enterprise together is that we're able to launch those programs, which are better for patients and members, more coordinated experiences, better for care outcomes. And we're able to do that because of that integration. And so it's been a good set of capabilities to lean back on during this time of COVID.
I agree, and I think it's allowed us to ramp up some of those services very quickly. We talked about telehealth, we talked about mail order. And the heart of our DNA as a health plan is to think about things as a provider. So even this discussion here, we're starting with the provider side. We're talking about the clinical element of this pandemic. And that's really the focus of us at a health plan. We do provide financing. We do in many respects act like other insurance companies, but our DNA still goes back to the provider side. And that's how we think both from a health plan as well as a health system perspective. And I think it really gets into one of my broader points, just to finish up, and as I turn it over to Allison, is at the end of the day, we're here to help manage health of individuals and people and patients in our communities. Insurance coverage is certainly a big part of it. We want to manage costs, but it comes down to really managing health in an effective and an integrated way, as Jaywan had alluded to. And connecting all these employees or resources, bringing everything together is core to what we do at the health plan, and we'll continue to do that even outside and once we get beyond the COVID pandemic. So with that, I'll turn it over to Allison.
Thank you, Kurt. Like many of you, as Kurt mentioned at Geisinger, we're very focused on the health of our employees, our patients, and our communities as we move forward. We've implemented programs and policies to target our COVID response from the start of this journey, and we'll continue to modify and adjust those as we navigate through this. If we go to the next slide, we'll talk through some of the things that we've done here. So employee screenings is certainly a core component of what we do We make sure that we're screening our employees prior to them coming to work, and we're also screening our patients as they come into the organization. But from an employee perspective, we're looking for some key symptoms. I do have a note on here that these symptoms are subject to change and have changed throughout this journey. So it's really important to review the CDC and Department of Health websites regularly for the most up-to-date information on what the signs and symptoms are. We also put masking policies in place. We're checking temperatures daily in the very near future. In some cases, we already are. We'll continue to roll that out across the entire organization. And I think what's important to note is that we will continue with the social distancing, the masking, and following the Department of Health return to work protocols throughout this entire process. So we listed some recommendations up here for you that may be helpful as you start to think about your return to work. If you are in different stages of that process, some of you may have employees that are still working, some may be shut down and are thinking about reopening. So these are some things that we're practicing right now, or that are recommendations that we've received. And there's a great website at the bottom of this slide that links to some of that return to work guidance from the CDC that's available. But again, the Department of Health and CDC have done a really nice job of trying to put some of these out available to the public. Continuing the social distancing, providing the signage, thinking about some of these items like non-essential travel, working from home where possible. Those are going to be critical steps to moving forward to opening businesses. Next slide, please.
Just on that front, though, and maybe Don, you could weigh in, because we've had actually quite a few reach outs from local employers asking us for a set of guidelines and some recommendations. And so I think we took a stab at formulating some of them here. But as we as a society start looking at reopening components of functions within society, I think we are getting a lot of incoming requests from local employers, whether it's an educational or training video or something along those lines around how do you stagger shifts, what are some tips around screening, how do you look at lunch breaks, what kind of hand hygiene, what kind of equipment for different scenarios. And I know that we've got some work underway to put some of that together in a more packaged way, but maybe you can comment on that, Don.
Yeah, that's right, Dr. Rue. We, because of our workforce and the needs to communicate these protocols to our workforce and the policies, and just some of the reminders about staying healthy, as Allison was outlining, we have put materials together that we are happy to make available to any of you if you're interested, whether that's signage or handout materials or materials for your website. Just reach out to us and your contact here at Geisinger Health Plan, and we will be happy to provide those. And if there's a need that you have that we have not addressed, we would certainly welcome the opportunity to see if we can address it for you.
Yeah, and we are in the process of formalizing those so that those materials will be available digitally. And so whether they're listed on the health plan website, we're working through some of those pieces right now, Don. So as soon as those become available, we'll provide additional outreach proactively as well. But in the meantime, please feel free, as Don mentioned, reach out to your representative of the health plan, and we'll do whatever we can to help you in this interim while we're formalizing that. Slide just gives an overview of what was released by the state as far as the targeting reopening on May 8th. So the red phase is kind of where we are in a current state situation. The yellow phase is when things begin to power back on, but still keeping a very close eye as we do that. I think it's really important as we start to think about transitioning back to work that we're making sure that we are still looking at social distancing and good hand hygiene, for really staying away from large gatherings, trying to continue to work from home even throughout those phases. So powering back on, but keeping a close eye. And then the green phase is really around even lesser restrictions, but it's still important in that green phase to continue to monitor the public health indicators, the staff and employees in your population, and continue to keep a close eye as we work through these phases based on the guidance from the state. We are seeing more and more information regularly updated around some of these opening phases. And so again, would reference those DOH guidelines and websites as a great resource to give some indication as far as what is appropriate and what's not. And there are different guidelines between work and social settings and also different types of work and industry as well. So they're a good reference point as you work through that. Next slide, please. So we wanted to talk a little bit about some of the resources that have been made available as part of our process here. And one of the things that is really important to note is that we've stood up a platform, and it's called Neighborly. There's a website there. And this is really a resource guide for anybody in the community. So employees, employers, brokers, whoever wants to utilize this resource. And you can go in by zip code and actually query and look for a lot of different social services that are available, whether employees or community members are in need of food or transportation or housing. We have on this site over 8,400 programs that have been loaded in just in our coverage area. And it's important to note that this was originally slated to go live October of this year, but with the pandemic, we shifted resources and made this a huge priority, and we were able to launch it by the end of March. We've seen significant usage of this site already and had some really positive feedback. And we have very much tailored this to even include local businesses that are maybe offering support during this time. So for example, we may have a local business who is offering a slice of pizza and a milk to kids who are out of school. And so, we have really gotten it down to the level of looking at individual communities to make sure that we're including all those resources, and they're being updated weekly to ensure that they're still viable. We've also enhanced our transportation services and implemented a discharge program, as we've noticed that in many of our communities, some of those transportation services have avoided service during this time. We have utilized Geisinger resources to be able to get people home from the hospital if they do not have a ride or transportation services. And to date, we've had about 30 discharges with that program out of our hospital facilities. We've also implemented an emergency food distribution program, again, for anyone in our coverage area to be able to get food if they are in an emergent need or have an issue. So far, we have over 350 individuals utilizing this program and have served over 200 households across our organization. We've also implemented virtual classes, health coaching, and stood up additional programs really targeting our at-home employees. So how do you stay healthy at home, including additional stress and anxiety support as well, as we know during this time that becomes a continued issue for employees, and we want to make sure that we have resources available for them. As mentioned earlier, our back to work resource toolkit and packages that we're compiling to make available for our employer partners are in progress, and we'll continue to roll out those solutions. And we've also done some care packages for our COVID positive patients as well as part of this journey to make sure that they are receiving things that they need to keep them comfortable at home, and just let them know that we're still thinking about them regularly and trying to keep them well. So lots of new programs. This touches only a small portion of all of the work that's been done, but just wanted to highlight some of these programs as well. Thank you.
Thank you, Allison. We have several questions from you. Thank you all for submitting, and you can still submit questions if you have not done that yet. The first one I want to kick over to Kurt, and it's just a request to repeat the premium relief for employer groups.
Yeah, we're working, with different employer groups that are in a financially challenged position to help them meet their premium commitment. So it's employer group by employer group. There's not a defined kind of program, but it's something that our account executive team is reaching out to different employers, and if they cannot meet their premium commitments, we're working with them to ensure that they can.
And then a similar question is from an employer who says, that if you're in a group plan that is up for renewal June 1st and the business is closed because they're considered non-essential, but how are we handling OEP right now for their workforce if their employees are unable to enroll Are we going to offer a month-to-month, or how can they?
So these are for employers that are no longer offering coverage.
I think it's employees who need to update their enrollment with their employer's health plan.
Renewals on a June cycle, I think is the
that
question.
are not currently working or open.
Well, all right, help me with it. So these are employers that on June 1st do not have, I'm missing this a little bit, they do not have coverage?
I
Or-
think their open enrollment is effective June 1st. Again,
Okay.
And they're not working, so they're.
Oh, so one thing, and I mentioned it, is that we're still allowing employers to provide coverage to individuals, even if they're not actively at work. I mentioned that earlier. So they would still be able to enroll in their health plan.
Okay, great.
And I think if there's questions about that, probably their sales rep would be a great person to connect with as far as specific open enrollment questions.
Yeah, I think
They can
that's,
help them with that process, probably.
and that would be through June 30th. So there's some dates on this, but I would encourage them to reach out to their account executive.
Okay, great. Dr. Rue, we had a question for a little more information regarding testing, antibody testing, and a desire to donate plasma. This individual isn't sure they had COVID, but was sick earlier and would love to donate plasma if they could, and wants to know because they're not certain they had it.
Yeah, so this is, first of all, we really appreciate folks that have reached out along those lines because I think it just demonstrates how committed folks are to do what they can to help. And so we definitely appreciate it. And believe it or not, we get a handful of people, more than a handful, that believe they had it because they came down with something that resembled the symptoms before COVID became a household name. And the only way to know is really by testing. I think the problem we run into is that the antibody testing is still so early in its technology. So we've read and heard and even talked to folks in the New York market and others that are using the antibody testing, but they're not using it to determine whether or not someone's immune because that technology is still not quite there. The science isn't quite there. They're using it from an epidemiologic standpoint to track the trend of whether the disease is becoming more or less prevalent. Is it speeding up or slowing down in the marketplace? And so for that use, the testing is pretty close. From the use of figuring out, is someone truly immune? I think there's still a lot of work to be done. I do think we'll get to that level of testing, in the coming weeks. And in fact, as I referenced earlier, our lab team is currently evaluating 3 different options that we think are closest that are commercially available. But the science isn't quite there yet. As an example, the accuracy on one of those tests is marginally better than a coin flip. And so obviously we wouldn't hang our hats on saying that someone has immunity based on something that's 55% accurate. And so the good news is the other 2 options are more accurate, but it gives you a flavor of the kind of evaluation that we have to do to figure out exactly, does someone definitively have it, or does someone definitively have the antibodies that are protective against the disease?
And to build on that a little bit, at least from the healthcare data, we did have an unexpectedly bad flu season. And the prevailing view now is we believe a lot of people did have COVID earlier and didn't know it. So this intuition is absolutely correct. It's what we're seeing potentially in the data.
Yeah, there was a report, I think it was the Washington Post, it was either yesterday or the day before, I forget, that also reported exactly what Kurt said, and a lot of health plans have seen a really bad, quote unquote, flu season that hit in December, January. And it also involved a significantly higher death rate than what the country is typically used to seeing with flu. And so the belief is that may have been COVID masquerading as flu, but before we really knew and had the ability to test whether it was COVID or not.
So on the subject of screening, there's a question, would we consider offering support for free or at-cost screenings for employers? Is that something we've discussed?
Yeah, so the screening criteria as set out by the FDA still governs our lab and every other lab. So there isn't, as yet, a role for asymptomatic broad-based screening, which would be, hey, test everybody. That would be the fastest way for us to lose our permission or our license with the FDA to do any testing. Because as it's currently mandated, there are very tightly controlled criteria that allow you to do the testing. But any scenarios that fall outside of that criteria, we don't test that, nor does anybody else, because it's regulated by the FDA. Now, as other testing options become available, and they're starting to creep into the picture, I think there's the ability to do more broad-based testing, but that too will be something that continues to develop in the coming weeks.
Okay, great. There was a question about telemedicine and if the uptake in it will ultimately drive down premium costs. Do we think that'll help reduce the cost of care?
So it's interesting. I was just in a conversation yesterday about this very topic around telemedicine and ultimately what it does to the cost of care. And this is even before COVID. There's been a lot of work done in the industry studying this dynamic. And there are some studies that suggest that it actually doesn't drive down the cost of care and may, in fact, drive up the cost of care. And the reason for that is because sometimes it fragments care when some unfamiliar physician enters the picture through telemedicine, makes some changes to the medication, sort of mucks up things because there isn't continuity of care, and then the patient goes back to their primary care doc or their cardiologist, and they say, what the heck happened to all the doses I had you on? No wonder your CHF is now out of control. That dynamic is very real, which is why what we have said is if you have a coordinated, integrated telemedicine program where it's on the same electronic medical record, it's ideally done by the same physician that you have a pre-existing relationship with. I think some of the studies, even from prior to COVID, suggest that in that kind of scenario, it would drive down medical costs because it would substitute for an in-person or a emergency room or urgent care visit, and you could do it from the convenience of your own home. And the ease of use makes it easier for patients to choose that as the modality of their care, as opposed to landing in the ER. So if you keep it to that continuity, coordinated, familiar doc environment, we think there's tremendous progress and promise. If it kind of gets outside of that to the, hey, I'm a doc in South Dakota and I'm on one of these commercial telemedicine platforms and I'm just here to take care of your emerging need today, and I'm off on an island and fragmented on a different electronic medical record, the evidence would suggest that that's actually cranking up medical cost.
I think one thing to extend on that, John, is it's one of the silver linings that we talked about as part of COVID and something we'll be looking at. And to the extent it does produce lower costs, and I think we have a belief it will, especially in our integrated system, that will ultimately impact medical premiums. And this is the experiment we're going through right now. And I think if I were to bet, particularly from a health plan perspective, it will lower premiums.
Another financial related question, Dr. Rue, are the financial assistance dollars that hospitals receiving enough to offset the costs that we've been incurring?
Unfortunately not, is the short answer. So to give you just some real life dollar impact from our experience. So early on, our finance team estimated that the net impact of COVID to Geisinger would be a negative 100 million or so per month. Now that we're about 6 weeks into this, our true experience has actually roughly tracked right along that estimate. Thus far, from the federal government, predominantly, we have received, I believe it's $71 million total of aid and support. And we anticipate, based on what's been passed, somewhere on the order of another 60 to 100 million more of aid coming. And that we have our fingers crossed, but that's certainly not a guarantee. So if you say in total, let's say we get some of that and we get 150 or 160 million back, every month our negative impact is about 100 million. And the latest estimates I've seen suggest that health systems, not just ours, but across the industry, will see at least a 6, if not a 9-month impact of this. But we're looking at 600 to 900 million on the negative side, and maybe recouping about 150 of it on the positive side. So the net impact is still pretty significantly negative.
Thanks, Dr. Rue. I think this question came while you were talking, Allison, about taking temperatures of staff as they're walking in. Is that now mandatory in the state of Pennsylvania?
I don't believe that it's mandatory yet. In many of the cases, there's a lot of recommendations that are coming out. We are adhering to a lot of those recommendations prior to things becoming mandatory. So in preparation, as a recommendation, we're following those policies.
It's a strong indicator that someone is at risk of having COVID, right, if they have a high temp.
Yeah, now they could have a fever from other stuff as well, obviously, but it's one indicator and obviously a reason to be more concerned. And that's what our screening mechanisms are intended to do, is it's a filter to identify people that we have to be more concerned about. What we started doing, when was that, Allison? About 4 weeks ago, we had universal masking for anybody on our property, on our locations, whether it's employee or patient. And anybody coming into any of our sites also has to go through screening, whether you're an employee or a patient. And part of that screening is related to checking for fever.
Yeah, up until this point, it was self-reported. A self-attestation will actually be checking the temperatures. But to Dr. Rue's point, it's in conjunction with a lot of other things that we're also asking patients and employees as they start their workday, and making sure that if there is any indication that they have any of those symptoms, that they're immediately not proceeding to work and they're following up with employee health and getting tested.
So we would make that recommendation to employers on the call right now, that would be something they would want to screen for.
Yeah, absolutely.
For sure. And this is where it gets to what we were talking about earlier with a lot of employers, the local businesses aren't at a size where they could have their own employee health department. And so a lot of them have reached out to us to sort of de facto serve in that capacity by giving them some recommendations. And I think you referenced, Don, some of our work around trying to package that and make it easier for folks to digest. We've been doing that and serving in that role for the local nursing homes as well, even though those aren't places that we own and operate. They also don't have the size and scale sometimes to have the ability to have trainers on donning and doffing the gear, or when they need to wear the gear, what kind of protective equipment is appropriate for which scenario, and training their folks. So we've been getting out and about and putting our teams out there out of a recognition that this is a great illustration of how we're all in this together. All it takes is one nursing home to light up with some cases, and those cases are coming to our hospitals, and it just underscores the fact that we truly are all dependent on each other's best efforts. So we've been doing that for a whole host of folks, local employers, local nursing homes, even the public health efforts of the state. We've been supplementing that by doing our own contact tracing program for anybody who tests positive, because those resources at the state level aren't enough to fully do that kind of programming. And so it's been a lot of that kind of effort that we've been focused on.
So if a local employer wanted some on-site support as they're bringing their business back with employee screenings, they should reach out and ask us if they're interested in.
Yeah, they can reach out and we can talk through what we have available for them. Absolutely.
We had a question about the May 8th date, and does that mean that we're going to enter the yellow phase on May 8th?
I think the way that the governor's information came out, it suggests it's county by county still. And so I think some of our counties, if you looked at it as things stand today, they probably would be in yellow. But some of the counties where we serve, if you looked at it as it were today, they would still be in red. And I think none of the counties where we serve would be in green. And so, again, it's still, a week away. So there's still a lot that can happen, but at least as things stand today, I think we have a combination of yellow and red.
And I think that's why referencing those DOH resources and the other resources that are available, because this information does change very rapidly, has changed rapidly over the course of the last certainly couple weeks to 2 months, and suspect that even as these start to phase out, that there may be lessons learned and things adjusted even as we go through that process.
There's been talk that the virus could come back in the fall. Do we have any thoughts on what that might look like in our communities?
Yeah, so I think there's pretty good consensus at this point that it will be back in the fall. If you look at what happened in the 1918 Spanish flu dynamic, if you look at what's happened in any kind of pandemic or epidemic scenario, it's not ever a single wave. And so I think there will be another wave that hits in the fall. I think as we head into that time period and what is normally the beginning of the next flu season, we're going to be making sure that everybody gets, or trying to get out there to make sure everybody understands the importance of a regular flu shot, because the last thing you want is both the flu and COVID together, because we know those outcomes are substantially worse. And at the same time, we're going to make sure that just because elements of society are opening back up and elements of our functions are opening back up, it actually means more than anything that this is the time to be extra cautious and prepared. And so we're managing, our bed capacity, our supplies, our staffing, and all of that, and that's going to be with us not just for a couple more weeks. It's going to be with us for months to come. Because we know that there are waves and then subsequent waves and so forth until a meaningful vaccine enters the picture, which I think people are still estimating to be at least 9 to 12, if not longer, months away. And so I think the short answer is yes, there will be a fall wave, but whether it's still one continuous wave or is it a separate wave, we'll be tracking that.
How do we see this impacting wellness programs?
Yeah, so we've already taken some steps with our employer groups that are still trying to proceed with wellness programs. We will continue to offer more virtual programming. So just like telemedicine and other areas that have adjusted, we'll be continuing to enhance our virtual options as well and seeing how we can do those classes that are typically in person in more of a virtual format. We're also seeing an increase in health coaching, which is a telephonic offering that we've always had available, as more and more employees are looking for support during this time, whether it's again for stress or anxiety, also to be able to maintain kind of a healthy lifestyle when they're somewhat limited or restricted to their homes. So we will see additional resources around stress and anxiety, additional virtual resources. And for those who are doing even screenings at the work site, we'll be looking at even that process to see how do we do more appointment-based programming to avoid kind of large gatherings of people coming through those screening sites. We'll be making those adjustments and really having a whole campaign targeted around the work from home employees and the remote employees, as we've just seen such an uptake in requests from that particular population. So how to stay healthy at home is going to be a really big focus as well. So we've already started to bring a lot of those resources together, and we'll continue to distribute those out to employers as we've done over the last couple of weeks, but even more so in the coming months.
Great, thanks, Allison. Although this is really focused on our commercial clients and brokers, there's a question about the D-SNP Medicare population and the possibility that we of loosening what can be purchased with over-the-counter products.
That's a good question. I believe there has been some loosening. I don't have an answer to that, but I think that's something we can take back.
Are you talking about CMS loosening what the OTC benefit would cover, or is it the health plans themselves that loosen that?
I think it gets into CMS loosening their definition, and we haven't I haven't thought about all of this in a commercial context, so we can get back to the group on that.
We mentioned a surge in June on one of our slides. So are we saying that, what does that mean
Yeah,
for society opening up again?
I think it depends on the area. So for Luzerne and Lackawanna, which seems to have been hit sooner and in a higher spike, I think the surge was really April into May. I think we're right now kind of seeing the plateau and starting to drift a little downward. So we probably may have just been in the middle of that surge. And we got to be a little careful because a day or two doesn't make a trend. So we want to see a solid week of that before we think we're out of the peak at least. But as far as the other areas, it kind of cascades later is what our predictive models have shown. And so if you look at areas like the Central, whether it's where Danville here, or if you look further down into the Harrisburg market or Lewistown, Lycoming area, or Jersey Shore, or even State College, what we've seen there is it kind of cascades 3 to 4 weeks later than Luzerne, Lackawanna. And so each of those mini humps or mini peaks, we think is, across the June, July, even into August timeframe. And the good news is all of the peaks look like they'll be smaller than what we had previously anticipated, but each county has its own mini wave. Even Lewistown right now, I think today I saw the numbers, we have 6 or 7 patients hospitalized with COVID. So the cases are there. Jersey Shore, same thing, the cases are there. So even these remote areas, we are seeing cases. And I think the other thing that's important to note is things don't just fall off the cliff, once you hit that peak. It gradually builds to that peak and then gradually comes back down. And so even after the peak, we know that we'll continue to have cases in all of these areas.
And to build on some of those points, from a medical claims perspective, we have seen a significant reduction in claim costs, both in the last half of March as well as April. We expect the same in May. The one thing we would say, and this gets into the surge question, we do expect a significant increase in claim costs as we go into June, July, and August. If we were to look at the total impact based on our current models, we think it'll be an overall nominally favorable impact from a medical claims cost perspective. Again, a lot of uncertainty with that. The COVID claims are going to be obviously more costly. There's a lot that has to be played out with this pandemic, but purely from a financial claim cost perspective, we think we'll be nominally better this year versus last year.
Do you have an answer on that DSNP question from our sales leader, Lou Iacovani, is listening in?
Okay.
Said that we do offer a $95 a month over-the-counter benefit, then that follows the CMS guidelines. So we're getting a couple questions, and Kurt, I know you addressed this, but just employers asking about premium relief and the stress that they're under right now. So maybe just a...
Yeah, I mean, I think to put some specifics on it, we're trying to react for each individual employer. We're tailoring different solutions depending on their ability to pay. So there's nothing specific to come out with to say, here's a defined program. I know some other health plans have done that. We're tailoring solutions at the individual employer level. And again, this gets into the broader point of reaching out to your account executive team and ask those specific questions based on your unique level of need.
Great. We have pretty much exhausted the questions. So I don't know if we want to just button this up with a few closing comments.
Yeah, this was, I think, a good experience for us. It's our first time at this sort of format. And one thing I'd add is I think we'd be looking for feedback in terms of how successful this is. This is, I think everybody on the call is getting an idea of how we work here at Geisinger. It's integrated. We're tightly connected from a clinical perspective with our health system. But also say it's very local. We're very much connected to the communities. We take this personally think Jaywan said, and I mentioned it a few times, we're all in this together, and this is part of us being all in this together. And the extent that we can stop this pandemic, it's going to help us all from a health perspective. And as I mentioned earlier, we also take this personally because it impacts people we work with, the doctors and nurses that we work with. So I think we'd all be looking for feedback on this. And this gets into the one of the things we talked about is this is a learning opportunity for us. And if we find this to be a good vehicle to communicate with the broader community, we'll certainly continue to do this.
No, I think first, just want to reiterate our thanks for all that you all are doing and for joining us on the town hall. Employers and the broker community, obviously key components and stakeholders and partners in terms of this effort around COVID. And so we appreciate your interest and all that you all are doing as well.
We have received lots of positive comments, so thank you everyone for joining us. Just based on your feedback, it looks like this was helpful for several of you, so we will evaluate it. I will tell you, we did get several questions asking about whether this would be available later, and it absolutely will be. So it is recorded, and we will make it available and post it on our website. So with that, we'll close out the session, and thank you all for taking the time and appreciate all the great questions today.